Free online STNA practice test.
Question 1. Which approach focuses on the physical and emotional care of a person, not just the person's physical condition or disease? Option A, holistic. Option B, holographic. Option C, holoscopic. Option D, holistic.
The correct answer is option A, holistic. The correct answer is A, holistic.
Question 2. Which of the following is not a type of health organization? Option A, a hospital. Option B, a hostel. Option C, a subacute care unit. Option D, an assisted living facility.
The correct answer is option B, a hostel. The correct answer is B, a hostel.
Question 3. Which of the following is a type of healthcare agency/organization that provides care for people who are dying and their families? Option A, hospice. Option B, preferred living facility. Option C, case management. Option D, assisted living.
The correct answer is option A, hospice. The correct answer is A, hospice.
Question 4. What does DON stand for? Option A, Director of Nursing. Option B, Division of Nursing. Option C, Doctors of Nursing. Option D, Directory of Nursing.
The correct answer is option A, Director of Nursing. The correct answer is A, Director of Nursing.
Question 5. What was the goal of the Omnibus Budget Reconciliation Act, OBR? Option A, to improve conditions for people in long-term care facilities. Option B, to provide confident transport services for patients or residents. Option C, to ensure that the hospital's budget did not exceed a decided amount. Option D, to reconcile difference between the patients or residents of an organization and the management.
The correct answer is option A, to improve conditions for people in long-term care facilities. The correct answer is A, to improve conditions for people in long-term care facilities.
Question 6. What does OBRA stand for? Option A, Omnibus Budget Reconciliation Act. Option B, Omnibus Budget Regulation Act. Option C, Omnipotent Budget Reconciliation Act. Option D, Omniscient Budget Regulation Act.
The correct answer is option A, Omnibus Budget Reconciliation Act. The correct answer is A, Omnibus Budget Reconciliation Act.
Question 7. The major objective of OBRA was: Option A, to establish safety and health standards for the workplace. Option B, to help patients and residents move from place to place. Option C, to improve the quality of care given to residents of long-term care facilities. Option D, to care for people who have problems with thinking and memory.
The correct answer is option C, to improve the quality of care given to residents of long-term care facilities. The correct answer is C, to improve the quality of care given to residents of long-term care facilities.
Question 8. A nursing assistant training program includes all of the following except: Option A, infection control. Option B, medication administration. Option C, feeding techniques. Option D, residents' rights.
The correct answer is option B, medication administration. The correct answer is B, medication administration.
Question 9. Which of the following does the state competency evaluation include? Option A, a physical examination. Option B, a stamina test. Option C, a nursing test. Option D, a skills test.
The correct answer is option D, a skills test. The correct answer is D, a skills test.
Question 10. To delegate a task means: Option A, to give another person permission to perform that task on your behalf. Option B, to consider the patient's or resident's individual needs. Option C, to perform the task properly. Option D, to understand why you may be asked to do certain tasks but not others.
The correct answer is option A, to give another person permission to perform that task on your behalf. The correct answer is A, to give another person permission to perform that task on your behalf.
Question 11. What is an attitude? Option A, the side of yourself that you display to the world as you communicate how you feel about things. Option B, a sense of humor. Option C, an unpleasant demeanor. Option D, the sense of pride and satisfaction you feel as a result of setting high standards for your performance.
The correct answer is option A, the side of yourself that you display to the world as you communicate how you feel about things. The correct answer is A, the side of yourself that you display to the world as you communicate how you feel about things.
Question 12. What is the term work ethic related to? Option A, a person's attitude toward his or her work. Option B, a person's ability to grow in his or her career. Option C, a person's work environment. Option D, a person's level of intelligence.
The correct answer is option A, a person's attitude toward his or her work. The correct answer is A, a person's attitude toward his or her work.
Question 13. What is it called when you imagine what it would feel like to be in another person's situation? Option A, sympathy. Option B, conscientiousness. Option C, accountability. Option D, empathy.
The correct answer is option D, empathy. The correct answer is D, empathy.
Question 14. Which of the following is not an attribute of a good work ethic? Option A, reliability. Option B, deceit. Option C, punctuality. Option D, cooperativeness.
The correct answer is option B, deceit. The correct answer is B, deceit.
Question 15. Why is it important to practice good personal hygiene? Option A, to present professional image. Option B, to keep yourself safe and healthy on the job. Option C, to give your patients and residents confidence that they will be well cared for. Option D, all of the above.
The correct answer is option D, all of the above. The correct answer is D, all of the above.
Question 16. Which of the following provides guidelines protecting the rights of residents in long-term care facilities? Option B, Omnibus Budget Reconciliation Act, OBR. Option C, American Nurses Association, ANA. Option D, the long-term care facility itself.
The correct answer is option B, Omnibus Budget Reconciliation Act, OBR. The correct answer is B, Omnibus Budget Reconciliation Act, OBR.
Question 17. Which right is protected by the Health Insurance Portability and Accountability Act, HIPA? Option A, the right to privacy. Option B, the right to respectful care. Option C, the right to control finances. Option D, the right to information about advocacy groups.
The correct answer is option A, the right to privacy. The correct answer is A, the right to privacy.
Question 18. Which one of the following could be considered psychological abuse? Option A, handling a person roughly. Option B, teasing a person in a cruel way. Option C, failing to change wet and soiled bed linens. Option D, forcing another person to engage in sexual activity.
The correct answer is option B, teasing a person in a cruel way. The correct answer is B, teasing a person in a cruel way.
Question 19. Healthcare workers are expected to provide care with sensitivity to a person's. Option A, culture and race. Option B, language and religious beliefs. Option C, age and gender. Option D, all the above.
The correct answer is option D, all the above. The correct answer is D, all the above.
Question 20. A man has experienced a severe myocardial infarction, heart attack, and has been left unconscious. A durable power of attorney has now taken effect. What effect will this legal document have? Option A, it will transfer decision-making power to another person. Option B, it will specify how the patient's property will be divided after death. Option C, it will transfer control of care to the man's insurance provider. Option D, it releases the care team from OBRA guidelines.
The correct answer is option A, it will transfer decision-making power to another person. The correct answer is A, it will transfer decision-making power to another person.
Question 21. Which one of the following is an example of nonverbal communication? Option A, using sign language to communicate with a deaf person. Option B, recording vital sign measurements in a patient's chart. Option C, gently touching a patient on the shoulder to reassure her. Option D, making a telephone call.
The correct answer is option C, gently touching a patient on the shoulder to reassure her. The correct answer is C, gently touching a patient on the shoulder to reassure her.
Question 22. Which one of the following is an open-ended question? Option A, are you Mrs. Brown? Option B, are you feeling okay, Mrs. Smith? Option C, Mrs. Murphy, do you want to take a walk? Option D, Mr. Jones, when you were growing up, what was your favorite food?
The correct answer is option D, Mr. Jones, when you were growing up, what was your favorite food? The correct answer is D, Mr. Jones, when you were growing up, what was your favorite food?
Question 23. When in a conversation, which one of the following is an example of positive body language? Option A, nodding encouragingly as someone speaks. Option B, crossing your arms across your chest. Option C, looking at the door. Option D, avoiding eye contact.
The correct answer is option A, nodding encouragingly as someone speaks. The correct answer is A, nodding encouragingly as someone speaks.
Question 24. Which one of the following is an example of an action that blocks effective communication? Option A, interrupting. Option B, not listening carefully. Option C, being judgmental. Option D, all of the above.
The correct answer is option D, all of the above. The correct answer is D, all of the above.
Question 25. Which one of the following should be your approach for resolving conflict? Option A, remain polite and professional while speaking with the person. Option B, bring up everything you think this person has done wrong. Option C, you do not have to listen to how the other person feels about the problem. Option D, go straight to the supervision, without trying to work it out with the person first.
The correct answer is option A. Remain polite and professional while speaking with the person. The correct answer is A. Remain polite and professional while speaking with the person.
Question 26. Which one of the following is an example of an acute condition? Option A, pneumonia. Option B, emphysema. Option C, diabetes. Option D, arthritis.
The correct answer is option A. Pneumonia. The correct answer is A. Pneumonia.
Question 27. You are caring for Mrs. Burrell, who lives in a long-term care facility. Which one of the following needs are you helping Mrs. Burrell to meet when you allow her to decide what she is going to wear each day and then assist her as necessary with her dressing and grooming routine? Option A, safety and security needs. Option B, love and belonging needs. Option C, physiologic needs. Option D, self-esteem needs.
The correct answer is option D. Self-esteem needs. The correct answer is D. Self-esteem needs.
Question 28. Which one of the following actions helps a present or resident to meet his need for love and acceptance? Option A, the nursing assistant serves the patient or resident his lunch. Option B, the nursing assistant offers the patient or resident a glass of water. Option C, the nursing assistant allows the patient or a resident to decide what type of shampoo he would like to use. Option D, the nursing assistant greets the resident with a smile, a kind word, or a gentle touch.
The correct answer is option D. The nursing assistant greets the resident with a smile, a kind word, or a gentle touch. The correct answer is D. The nursing assistant greets the resident with a smile, a kind word, or a gentle touch.
Question 29. Which of the following is the most basic human need? Option A, love and belonging. Option B, self-esteem. Option C, physiologic needs. Option D, self-actualization.
The correct answer is option C. Physiologic needs. The correct answer is C. Physiologic needs.
Question 30. Mrs. Oliphant is a resident at the long-term care facility where you work. She has arthritis that is very painful. Mrs. O rarely has anything pleasant to say to you or anyone else. What should you do when caring for her? Option A, provide the necessary care as quickly as possible, and then leave. Option B, realize that Mrs. Oliphant's chronic pain may be affecting her behavior. Option C, discuss Mrs. O's miserable behavior with the other nursing assistants on staff. Option D, avoid providing care to Mrs. O.
The correct answer is option B. Realize that Mrs. Oliphant's chronic pain may be affecting her behavior. The correct answer is B. Realize that Mrs. Oliphant's chronic pain may be affecting her behavior.
Question 31. Nursing assistants demonstrate a holistic approach to healthcare by considering: Option A, a person's emotional, social, spiritual, and physical needs when providing individual care. Option B, the role of the health team, medical team, and family. Option C, the person's disease, level of consciousness, and prognosis when providing care. Option D, all persons to be cared for according to the doctor's diagnosis only.
The correct answer is option A. A person's emotional, social, spiritual, and physical needs when providing individual care. The correct answer is A. A person's emotional, social, spiritual, and physical needs when providing individual care.
Question 32. The nursing assistant is aware that people who have a terminal illness or condition will usually: Option A, be well in a short period of time. Option B, be a patient or resident for a long period of time. Option C, die as a result of their illness. Option D, be expected to recover after therapy and medication.
The correct answer is option C. Die as a result of their illness. The correct answer is C. Die as a result of their illness.
Question 33. Which of the following patients is most likely required care in the intensive care unit of a hospital? Option A, a woman who is going into labor and expecting twins. Option B, a man who experienced a heart attack one day ago. Option C, a man who is 79 years old and lives with several chronic disease. Option D, a woman whose worsening depression requires hospitalization.
The correct answer is option B. A man who experienced a heart attack one day ago. The correct answer is B. A man who experienced a heart attack one day ago.
Question 34. What is the most common cause of infection in the healthcare setting? Option A, viruses. Option B, parasites. Option C, fungi. Option D, bacteria.
The correct answer is option D. Bacteria. The correct answer is D. Bacteria.
Question 35. Bacteria may enter the body through: Option A, the mouth. Option B, the nose. Option C, cuts or breaks in the skin. Option D, all of the above.
The correct answer is option D. All of the above. The correct answer is D, all of the above.
Question 36. Which one of the following will keep your immune system strong and healthy? Option A, getting proper nutrition, adequate rest, and regular exercise. Option B, taking antibiotics. Option C, sneezing and coughing. Option D, crying.
The correct answer is option A, getting proper nutrition, adequate rest, and regular exercise. The correct answer is A, getting proper nutrition, adequate rest, and regular exercise.
Question 37. Which one of the following diseases is caused by a blood-borne pathogen? Option A, hepatitis A virus. Option B, measles. Option C, tuberculosis. Option D, hepatitis B virus.
The correct answer is option D, hepatitis B virus. The correct answer is D, hepatitis B virus.
Question 38. Hepatitis B virus can be transmitted in all of the following ways except Option A, a needle stick injury. Option B, writing an exposure control plan. Option C, direct contact with blood. Option D, a gentle touch given to a patient or a resident.
The correct answer is option D, a gentle touch given to a patient or a resident. The correct answer is D, a gentle touch given to a patient or a resident.
Question 39. What is the single most important method of preventing the spread of infection? Option A, hand washing. Option B, writing an exposure control plan. Option C, avoiding patients and residents who are infected. Option D, taking airborne precautions with patients or residents known to have an infectious disease.
The correct answer is option A, hand washing. The correct answer is A, hand washing.
Question 40. What items of PPE should you wear if your patient or resident is likely to cough and spray you with small blood droplets? Option A, mask. Option B, face shield. Option C, eye goggles. Option D, all of the above.
The correct answer is option D, all of the above. The correct answer is D, all of the above.
Question 41. Body mechanics refers to Option A, the food the body used for fuel. Option B, maintaining good overall health. Option C, efficient movement and safe use of the body to perform physical tasks. Option D, decreasing the base of support.
The correct answer is option C, efficient movement and safe use of the body to perform physical tasks. The correct answer is C, efficient movement and safe use of the body to perform physical tasks.
Question 42. You need to lift a resident from the bed to a chair. Which one of the following would you do to avoid injury to yourself and the resident? Option A, bend your knees and hold the person close to the center of your body. Option B, use the large muscles in your back to complete the transfer. Option C, stand with straight legs and feet spread apart. Option D, stand with your legs together and your ankles touching.
The correct answer is option A, bend your knees and hold the person close to the center of your body. The correct answer is A, bend your knees and hold the person close to the center of your body.
Question 43. The proper technique of lifting involves using the muscles of the Option A, shoulders and upper back. Option B, chest and abdomen. Option C, lower and middle back. Option D, thighs, hips, and buttocks.
The correct answer is option D, thighs, hips, and buttocks. The correct answer is D, thighs, hips, and buttocks.
Question 44. In the event of a fire in a resident's room, your first action should be to Option A, move the resident to a safe place. Option B, activate the alarm, if the alarm has not been sounded. Option C, contain the fire by closing doors and windows. Option D, extinguish the fire if possible using the fire extinguisher.
The correct answer is option A, move the resident to a safe place. The correct answer is A, move the resident to a safe place.
Question 45. Oxygen in use signs are posted for patients or residents receiving oxygen therapy. Option A, to warn patients or residents and visitors that extra precautions are needed. Option B, for the respiratory therapist to know which rooms to check. Option C, to remind visitors that smoking is allowed only at the doorway. Option D, because OBRA requires treatment signs at the door of all patients and residents.
The correct answer is option A, to warn patients or residents and visitors that extra precautions are needed. The correct answer is A, to warn patients or residents and visitors that extra precautions are needed.
Question 46. How does the nursing assistant create a solid base of support for herself when performing a lift? Option A, by moving her feet apart either by widening the stance or by placing one foot in front of the other. Option B, by leaning over as much as possible, maintaining her balance by raising the center of gravity. Option C, by using her arms and shoulders to support heavy weight. Option D, use the patient's or resident's weight to assist in creating a base.
The correct answer is option A, by moving her feet apart either by widening the stance or by placing one foot in front of the other. The correct answer is A, by moving her feet apart either by widening the stance or by placing one foot in front of the other.
Question 47. A person with paraplegia is paralyzed. Option A, front the waist down. Option B, from the neck down. Option C, on the left side. Option D, on the right side.
The correct answer is option A, front the waist down. The correct answer is A, front the waist down.
Question 48. At minimum, how often must a restraint be completely removed, and for how long? Option A, every day for 1 hour. Option B, every 2 hours for 10 minutes. Option C, every evening for 2 hours. Option D, every hour for 15 minutes.
The correct answer is option B, every 2 hours for 10 minutes. The correct answer is B, every 2 hours for 10 minutes.
Question 49. You apply vest restraints so that the flaps, option A, cross in the back. Option B, cross at the side. Option C, are left open. Option D, cross over each other, across the person's chest.
The correct answer is option D, cross over each other, across the person's chest. The correct answer is D, cross over each other, across the person's chest.
Question 50. You work in a hospital. One of your patients has a catheter that is causing her discomfort, and she keeps trying to pull it out. What might the doctor order to prevent the patient from removing the catheter? Option A, a mitt restraint. Option B, a waist restraint. Option C, a vest restraint. Option D, a sensor alarm.
The correct answer is option A, a mitt restraint. The correct answer is A, a mitt restraint.